This is the first of a three-part PowerPoint on smoking cessation. Let's look at the scope of the problem of tobacco use. The number of deaths that in the world that can be attributed to chronic obstructive pulmonary disease has increased to nearly 200% in the last 2 decades and accounts currently for about 4% of world death. The World Health Organization ranks the disease burden, if you will, the cost of care and human suffering of COPD and smoking-related disease to be the 12th most severe disease burden of the diseases, but it is estimated to become the 5th by the year 2020. Currently, 1.1 billion people worldwide smoke, and that is estimated to be increasing to 1.6 billion by the year 2025. So we're talking about a significant problem that will occur during your nursing career. The increases are predicted to be greatest in low and middle income countries and in teenagers and young adult populations. In America, about 21% of adults smoke. This has a wide range geographically across the nation. It's different in different communities and with different populations, and in some communities it's as much as 36%. The national expenditure for smoking-related disease is estimated to be $4.5 million, and this is to pay for the $1.3 million annual admissions related to heart disease and pneumonia that can be attributed to smoking. There is currently a new JCO standard which says smoking cessation must be offered to all patients with pneumonia, MI, or COPD admitted to a hospital. What do smokers feel about this, and what are their desires? Research shows that 70% of smokers actually desire quitting, but only a third of healthcare providers offer prevention or cessation support. The evidence is very clear that healthcare provider support and healthcare providers with smoking cessation training are more likely to offer support. It was recognized a decade ago that the majority of medical school grads felt underprepared for nicotine dependence treatment. It was also identified that part of it was that there was lack of a national curriculum for medical schools, and in the literature there is no evidence that schools of nursing offer smoking cessation in their curriculum. To this end, the University of California at San Francisco developed a nursing curriculum called Treatment for Change, the clinician-assisted tobacco cessation, aimed at nurse practitioners and clinical nurse specialists, so graduate nurses, advanced practice nurses, to assist and support smoking cessation efforts. The series of slides that I'm going to look at that looks at the current research and evidence regarding smoking cessation program is a national program, and it's listed on this website, which is the American Healthcare Research and Policy Institute. There are 10 key recommendations that were published just in 2008, and I've highlighted and read the parts that I think would be salient features for you to know. Tobacco dependence is a chronic disease. It's not a failure of character. It is a chronic disease. And despite that, they know that although it takes multiple attempts to quit, that repeated intervention can significantly help increase the rates of quitting. It's been determined that all healthcare clinicians need to develop systems to document tobacco use and tobacco status and treat every tobacco user seen in any healthcare environment. And clinicians should try to encourage every patient who's willing to make a quit attempt and to use the research-based, evidence-based counseling treatments and also the medication recommendations. Even a really brief tobacco dependence treatment has been shown to be effective. And when I state really brief, I'm talking about a 3-minute intervention with patients on an ongoing way is shown to be effective. Research is now strongly supporting not just individual but group and telephone counseling as being effective. And we'll look in more depth at how what this telephone counseling consists of, but it includes practical counseling, problem solving, and quitting strategies, and then looking at the common problems associated with quitting. Weight gain, for example, is a big concern, and then also the delivery of social support. It has now been shown that both print and web-based materials appear to be effective in helping people quit. There are numerous medications that have been supported in the research as effective in helping people quit. There's 7 first-line medications. 5 are nicotine-based and 2 are non-nicotine-based, and they really help with increasing long-term abstinences. And I thought it was interesting that rather than encouraging patients to go cold turkey, if you will, that they actually highly recommend and prefer the use of the medication regimens because that's how efficacious they are. Although counseling by itself is effective and medication is effective, the most effective method is the combination of counseling and medication. And this has to do with the number of counseling sessions available. So we'll look at the research a little later on to look at how many counseling sessions have been shown to be the minimum to be the most effective. I didn't even know that telephone quit lines existed, but telephone quit line counseling has been shown to be effective, and particularly with diverse patient populations. For tobacco users that are unwilling to consider making a quit attempt, there are motivational techniques that can be used, and these have been shown to be effective and effective in helping them with their future quit attempts, since we know that this is a situation where there are frequent episodes of relapse. There's an advocacy role for all of us in healthcare regarding tobacco cessation, and that is to advocate to third-party payers to make sure that all insurance plans include payment for counseling sessions and the medications that are identified and deemed effective. There are new recommendations from recent research, and so I'm going to go through those briefly. I already mentioned to you that even though a smoker may not be at this time willing to make a quit attempt, that motivational intervention techniques are effective, and this has just been shown in the last 2 years. New recommendations include that people identified as light smokers, so people identified as smoking less than 10 cigarettes a day, should still be identified and strongly urged to quit. The evidence shows that expanding vital signs to include tobacco use status as quitting, having quit, currently smoking, and the use of any other kind of reminder system such as chart stickers or computer prompts help to increase the rates of clinician intervention. I think it's really interesting that clinicians should encourage all patients to use the medications deemed effective. And there are some populations where we will see that there's insufficient evidence that they are effective and may in fact be detrimental. And those are pregnant women, smokeless tobacco users, light smokers. It's better to use personal counseling, and adolescent groups. Combination therapy is shown to be more effective. Like I said, counseling is most effective in the treatment of adolescents. Because it is known, the secondhand smoke effects are known to be harmful to children. All parents in a pediatric setting we should be interviewing them to ask if they are smokers and to offer them cessation advice and assistance.